Hey guys, so in today's video, I figured I would take the time to respond to a comment that one of you left. So I have my phone here and I'm going to read the comment and then I am going to share the information that the person requested. So this comment was left on my video titled Medical Assistant Tips Rooming Talkative Patients, where I was kind of going over a few things related to dealing with patients who just cannot stop talking or are really, really talkative. And this person, Queen Chelsea, said, "Hi, could you do a video on how you do the full patient interview? Thanks for this video you have uploaded, by the way." So thank you for your comment. And now I'm going to share the information that you requested. So by the full patient interview, what I'm assuming you mean is the full rooming process. So I will start with getting the patient from the waiting room. So the clinic that I worked at, because I'm currently not working due to issues. If you've watched any of my recent videos, you have an idea of what's going on with my health, but basically, the clinic that I worked at, we used Epic. And so when somebody would be checked in, they would show up as arrived. And so then I would assign them to a room based on whatever provider I was working with that day. I would assign them to a room. And so once I assigned them to a room, once I assigned them to a room, then I would go out to the waiting room and call the patient back. From the moment that I call them back, right inside of the door, like from the waiting room to the exam room area, there's the scale as well as the tool we use to measure the height, because we don't use the one that's on the scale. So I would take their weight. Sometimes some people don't want you to take their weight and you can put refused, but I do try to get their weight just because it's important. It's part of vitals, is weight and height. So I don't always do the height if it's been taken within like 3 to 4 months and they are an adult. If they are a child or someone who's under the age of 18, obviously, then I also take the height every time, because kids can or tend to grow and have the growth spurts and all that. So then I will take them to whatever exam room that I assigned them to. And then I will start by verifying their date of birth. So normally what I'll do is I'll say, "Can you verify your date of birth for me?" Or if it's a kid, I'll say, "What's your birthday?" They don't always know. I tend to do that for older kids. If it's a younger kid, I'll ask the parent to verify their date of birth. And then from there, I go through and I say, "So what are we seeing you for today?" Or if it's like a family medicine type visit and not an urgent care visit, I will say, "So we're seeing you today for a medication review or an annual or a well child," whatever it says that they're there for. I don't always assume that that's correct though, because there have been plenty of times where it has said that the person's there for a med review, but it's really an annual, or it says they're there for an annual, but they just had their annual and they're coming in for a med review or something else unrelated. So I don't ever just assume that that is ultimately correct. So from there, I will go through, I'll do all their vitals. So I will get their pulse, their respirations, their blood pressure. I will do the height, the weight. I ask them what their pain is on a scale from 0 to 10. I say 0 because sometimes I've asked people, like, "Are you in pain today?" And they say no. And then as I'm moving on to the next step, they'll say, "But my head hurts," or something like that. And I'll say, so I started saying, "Would you please rate your pain right now on a scale from 0 to 10. So they can tell me that they're not in pain, but, they can also tell me that they are in pain. And then I'll ask them where if they say they're in pain, and I'll mark that down. I do like that Epic also has a place to write little notes, because sometimes, like, you can only choose one in Epic, but like if the person says that their back and their hip hurts, then I'll write and hip also in the notes. So then the provider's aware that their hip was also hurting. So then from there, I go through all of their allergies. So I will go through and what I will say, if the person has been there within the last month, I will ask them if there's any new allergies. Sometimes they don't remember what is on their allergy list. Sometimes they do. For the most part, people do if they've been there within a short period of time. But you know, if they were just there within the last week, they should know what's on their allergy list. So most of the time I will go through and I'll say, so on your allergy list, I have that you're allergic to amoxicillin, penicillin, whatever, and latex. We'll just go with that. Or if it says that there's no known allergies, I will ask them, are you allergic to any medications or and are you allergic to anything in general? I ask medications first because that's obviously the most important thing, because like your pet dander and things like that are not going to be as important. And I say important because they are important, but they're not going to be as important for us to know as like if you are allergic to amoxicillin and the provider wants to prescribe you amoxicillin, if that makes sense. Hopefully that makes sense. So then once I go through their allergies, then I go through their medication list. But before I go through their medication list, I make sure that the pharmacy is up to date. And so I will say, so if the provider has to send in a medication for you today, what pharmacy did you want to use? And sometimes they'll say the one that's listed. Other times they'll say that they switched pharmacies. So it's good to ask that at every visit, just because you never know when somebody is going to change the pharmacy that they use. And you never know, like if they use one pharmacy for a specific medication that maybe the other pharmacy that they normally use doesn't carry or something like that. So it's good to make sure that you're verifying that you are sending medications to the correct pharmacy for the patient as well. But also just making sure that you have the most up-to-date information in the patient's record as possible, because it helps when they're making phone calls or they're calling the office and asking for refills to be sent in. Then you don't have to like deal with the back and forth of, oh, I needed it sent to this pharmacy and all that stuff. So once I have verified that it's the correct pharmacy, then I will go through medication by medication. I will tell you, if you are a patient who takes a ton of medications, please bring a list of medications to your doctor's appointments with you with the correct dosages and how many times a day that you take it, because it is so very helpful when you take like umpteen million medications to have the correct dosages listed. Because especially if you have a problem remembering all of your medications, it's very helpful to whatever medical assistant or nurse or provider is caring for you that day. So then it makes our job easier. And then we know that you're getting the correct medications with the correct dosages and all of that stuff. So once I've gone through the medications, that is usually the end of the rooming process for me. I will ask if they need any refills and I will mark that on the medications. I'll flag it so then the provider can see like, oh, needs refill, needs refill. I tend to also go through immunizations if it's a family medicine visit, and I will pull in all of their most recent immunizations if they need like to be reconciled or whatever. Otherwise, I just kind of look at their health maintenance, and if there's a care gap that needs to be filled, then I will do that, like whether it is filling out a PHQ-9 and GAD-7 for depression anxiety screenings, or if they need like tobacco cessation or smoking cessation counseling or whatever education, I will fill that care gap as well. And there are multiple ways that you can do that. If you guys want more information on closing care gaps, I can make another video talking more about that. But yeah, hopefully this was helpful. That is basically the end of it. Before I leave the room, I will say, like, for example, you'll be seeing Dr. Smith today, and Dr. Smith should be in with you shortly or something like that. If it's a family medicine visit, then I will say, you know, Dr. Tammy will be in with you shortly. I'll let them know you're ready or something like that. So hopefully this helped to the person who requested this. I hope you found this helpful. If there are any other requests that you guys have for topics that you'd like to hear me discuss on my channel in the future, let me know. If you guys have any questions that I can answer or anything else that you'd like me to talk about, let me know that as well. And I will talk to you guys in my next video.